Welcome to PalliCovid ECHO section 6, and today our sessions on how can you take care of yourself in a stressful environment, burnout and self-care. The sessions will be carried by Dr. Sunita Daniel. Welcome, ma'am. And I owe to Sunil sir. Hello, sir.
Good afternoon, and today is the last session of this COVID series. So today is a very important topic for health professionals. So we know that health professionals are already stressed because of many things, including working more time, more patients, and things like that. But in this COVID situation, many are stressed because maybe physically, emotionally, spiritually, and all the aspects of all the domains of suffering will be there. We will hear from Dr. Sunita how to take care of uh, how to take care of us in the stressful situation. So Dr. Sunita Daniel is a uh, she's a palliative care physician. She has done her MRCP in general medicine as well as in palliative medicine from UK, and currently she is working as a specialist palliative care physician at General Hospital Ernakulam, and she has worked in and outside India, and she has good experience in palliative care. Um, so, Dr. Sunita, welcome you, and it's over to you.
Thank you very much, Sunil. Am I audible?
Yes, you are audible.
Okay, thank you, Palli Media, for giving me an opportunity to take this session. And can I have the slides, Rajalakshmi? So before I start, I would like to thank Dr. Chitra, Dr. Seema, Dr. Purnima, and Dr. Audit, who has contributed in this portion of the ebook. And Dr. Chitra and Dr. Seema is kindly with us today. So she's happy to take questions in addition. And thank you very much, ma'am, for that. So I'll be dealing with or we'll be discussing briefly on burnout and self-care. Next slide, please. So in the next 20 minutes, what I'm trying to cover is I'll bring a case study that is relevant to the situation, talk to you about a bit of burnout, compassion fatigue, and moral distress, and also cover specifically to COVID-19 pandemic, what are the risk factors, specifically because of the pandemic, what are the principles of intervention that, what are the normal way you could deal with burnout, compassion fatigue, and again, with specifically related to COVID-19, we have suggested some principles of interventions and intervention techniques, and conclude with saying about something about self-care. Next slide, please. So this case study it's a case that I got from one of the colleagues actually working in the United States and Canada. So just like our Zoom Zoom sessions, they also have Zoom sessions every week, and this was the Pacific group of Zoom session is happening every week, but unfortunately it happens at 2:30 a.m. in the morning, so we were not able to join. But one day when I was awake at 2:30, I thought I'll join, so I happened to attend one session, and this case was discussed there, which is relevant to our discussion, so I've taken it from them. So basically this case is about an older adult lady who was admitted to hospital, and she was intubated and ventilated, and she was on pressor support. She was initially admitted with a cardiac event and then was later found to be COVID positive because she developed some febrile symptoms. So they've mentioned older adults, she's actually 65 plus. And the palliative care was consulted at day 12 of the hospitalization, and the goals of care was discussed. Now, the discussion was mainly around the challenges that was faced by the ICU physician in dealing with this patient. Because when the palliative care was called, obviously the involved in goals of care discussion, they had a discussion with the family over telephone. About what the patient wanted in the past. She was on ventilator. There was discussion about should we be withdrawing or not. But what the ICU physician found most challenging was, first thing was mainly because of all the unknowns in providing a prognostic information. So in her mind, she thinks it's an infection, it's COVID-19. things are changing every day. So what if I withdraw and something happened, like a cure comes and you can manage her? So that sort of thing was in her mind. And the other thing that the ICU physician was mainly concerned about the fact that now in that hospital at that time, they were not overwhelmed or anything. They had lots of ventilators, but they will come to a situation when they will have to ration the ventilator. So she was worried about that. And she also had a feeling that if she starts a goals of care discussion with the family would be thinking it's because she wants to consider the resources, and that's the reason they are thinking about having this discussion. So this emphasized the stress all these frontline health workers are facing into the day-to-day job when they were managing the situation. But what the palliative care team felt was that actually, if you take the COVID-19 out of the equation, this lady had comorbidities. Previously, before she had this infection, she was fit and well, she was quite active, and she had made it clear that if such a situation arises, she wouldn't want to compromise her quality of life over the quantity of life. She had told that clearly to the family. She had written it down. So all this discussion had happened. And the ICU concern also said that because she has been on ventilators for such a long time, she's not going to get a quality of life back. If she survives this episode and goes home, she's not going to get the quality of life back. She's not going to get what she wants. So that is very, very clear. So what they finally ended up doing was that they went back and had a telephone conversation again with the ICU physician, talked to them about that, talked to them about the fact that consider this, take COVID out of the equation and consider this like any other goals of care discussion. What would you do in that situation? So this again highlighted the moral distress that all these frontline workers are facing. When they go through this new pandemic that everybody's finding it as a challenging situation. Next slide, please. So coming to our main topic. So what is burnout? So burnout is usually it's the stresses that arise from the clinician's interaction with the work environment. So there are three terms that is in relation. They're interrelated to each other. We've got burnout, we've got compassion fatigue, and we've got moral distress. And I'll be talking in more details about burnout in the subsequent slides. Just one word about compassion fatigue. And compassion fatigue is sometimes it's usually it comes over a long period of time. And I think each and every one of us sometimes might feel that we are also in a danger of going into compassion fatigue. It's as the name suggests, it's a fatigue, it's an indifference to the suffering. So it's usually seen in the physicians who's dealing with people in traumatic life events or as terminal illness for a long period of time, and it's referred to sometimes as a cost of caring for these people for a long period of time. We tend to become indifferent to their worries, and sometimes some people actually describe compassion fatigue as some sort of post-traumatic stress disorder because of dealing with the same sort of patient for a long period of time. Moral distress, as I mentioned in the previous slide, is basically a distress or a trauma, a mental trauma that the physician faces when they have to do situations which is against their moral belief, like rationing the ventilators when they've never had to do that before in the past, but they have to do it now. They can't offer a ventilator to a patient only because you don't have enough ventilators. So that sort of distress that the physician facing is equivalent to the moral distress. Next slide, please. So as I said, all these three are interconnected. One can lead to the other. So you have to address all these three when we deal with the burnout. Next slide. So so how do you define burnout? So burnout is basically it's defined as a syndrome. It consists of three major aspects of the syndrome. First one is something called emotional exhaustion. There's depletion of energy and you feel so exhausted. So you lose enthusiasm for work, you lose enthusiasm for the work, and then that can lead on to something called depersonalization, where you treat patients or people as objects. So you don't treat them, you don't tend to treat them as patients, you tend to treat them as objects. And you have some sort of a mental distance from one's job. So you feel that, why am I doing this every day? There's a feeling of negativism. There's no point in doing it all the time. There's cynicism. There's nothing good coming out of it. All this comes out of a feeling of that mental distance and depersonalization. And then that leads to something called a low personal accomplishment. So basically, you tend to feel that there's no point in doing anything. I'm not accomplishing anything. This reduced in the professional efficacy of the. You feel as if you're not doing anything, as well as you tend to have a reduction in your professional efficacy. Now, all these three, when all these three things happen together, you tend to define yourself as you are burned out. Next slide, please. So what are the clinical features? So you can see, and you could just maybe go through this ourselves. I did go through it when I was going through the slides and preparing for the slides. I was trying to find out whether any of these features are coming to me also, because it's important for each and every one of us to actually go through these symptoms and think that at any point in our life, are we getting all these symptoms? So you tend to have avoidance of emotional, difficult, and clinical situations. There's irritability and hypervigilance. There'll be a lot of interpersonal conflicts, over-identification or over-involvement with different situations. You tend to, some people try to become perfectionist, and they are very rigid in their decisions. Sometimes some people tend to have a poor judgment, and which can lead to some violations in the boundaries, violations in the professional boundaries, and personal boundary violations. It can lead on to, sometimes it can lead on to social withdrawal and numbness and detachment. You could have difficulty in concentrating. We tend to have some spiritual questions. We tend to question the meaning of life. If you're a religious person, you tend to question your prior religious beliefs. You could have sleep problems, intrusive thoughts and nightmares. And some people even go on to have addictive behaviors. And sometimes it manifests as physical symptoms. You could have lots of, like frequent headaches, GIT disturbances, immune system impairment. So there's a lot of symptoms or a lot of presentations in which, a clinician can present with having burnout. Next slide, please. And this is seen in this curve. So this is basically something called a stress curve. So we can look at when you're comparing your stress levels and the performance. So in the initial part, you can see the green part where there's too little stress. Then we need a bit of stress to actually perform well. So if you don't have that much stress, like, if maybe there's no deadline, you need to submit within this time. If there's too much time, a month's time, maybe it's too much for us. You will be inactive. You don't tend to work. So that you become too laid back in the initial green point when there's too little stress or there's underload. So gradually the stress comes up and you enter into the orange bit where there's optimum stress and there's maximum performance. You could say it's the top of the curve where there's maximum performance. But then once the stress becomes too much, so once the stress goes on and on, you go down the bottom of the curve when you become more exhausted. And then you go down to the red bit where you become completely burnout, and it leads down to anxiety, panic, and anger, and goes to a breakdown. So that's how our performance changes with the stress level. So we should always be careful to have that bit of stress that is needed for us to go forward, but not to give into too much of stress that lead to a breakdown and a burnout. Next slide, please. So what are the factors that can contribute to burnout? So as I mentioned, there are a few factors which can contribute to the burnout, like workload. So that is actually how the system is behaving. So sometimes some people can be working in a situation where there is too much patients and too little doctors. So there's a staff shortages are there, and there's financial restraint. So if you're working in a private setting, you don't have enough. They wouldn't appoint enough doctors to work. So you have to a single doctor have to carry on with the work of 2 or 3 people. So there's increasing workload. Other factors like control and training. That you can have a control, and training can lead to further control, which will help you to have an emotional stability and help us to cope with the challenges in life. And sometimes the training is not adequate enough. So in situations like, sometimes clinicians expected to do things that they haven't been trained enough on, and because there isn't anybody else to do it, you tend to do that. So if you're faced with such situations where you have to take some responsibilities, but there's no inadequate training, that tend to put us into a lack of control. We'll lose our control, and that tend to put us into breakdown. Now, some teams, you could have some conflict. So you could have conflict between doctors inside one team. You could have conflict between doctors and nurses inside the team. That can also add on to the burnout. sometimes your values. So if you have got, there's no congruity between your values, personal values, and the values that is central to the work environment, that can also add on to our stress and cause burnout. So maybe you're working in a situation where you tend to do things, you tend to have to do things which is against your personal values, and then you may not feel comfortable in working in that unit. So that is another important one. But there's no congruence between your values and the values of the team. Then sometimes it's always good to reward people. So suppose the organization, some organizations actually are very good at rewarding doctors when they achieve more, like small, either mentioning the name or financial rewards. So when there's not much rewards, even in a raise in salary sometimes considered as a good reward. So when there's a limited or inadequate financial rewards, when you do an extremely challenging work, and rewards can give a positive boost for us. If that's not there, then you tend to become more stressed. And you could have other emotions can affect. So our emotions, suppose you're looking after patients for a long time, and there is a death of a patient whom you have been attached so much to the patient and the patient dies suddenly, that can affect us emotionally, and that can affect the work also. So when this long-term relationship is lost, and then you can experience that feeling of grief and loss. Now, the extrinsic factors are your own family factors. Such issues can be happening at home, at home with the family, with your spouse, with your financial health, other societal pressures, limited supports of childcare, looking after kids, looking after elderly parents, you're coming to work. So lots of extrinsic factors also affect us in our day-to-day work, and also some personality factors. Some people are like you say, type A personality, who are very over-invested. They're highly motivated, and they're professionals, and they've got intense investment in their profession. And those people, when they don't achieve their goals, they tend to have a breakdown and burnout pretty quickly. Next slide, please. Now coming to COVID-19 pandemic and what are the specific risk factors, the working environment of COVID-19, in addition to all this. So all these regular risk factors are there for all the medical professionals. What are the additional risk factors of COVID-19 pandemic? So you can say that, there's a disturbed work schedule. What is a normal practice is not that is happening when you're facing a pandemic. The schedule is disturbed. There can be a blurring of the roles. You can have extended shifts that you normally don't do. Obviously, your sleep patterns become disrupted. And you're constantly being exposed to all this morbidity and mortality. You're constantly seeing patients dying all the time, which may not be the usual norm for you. Constantly discussing morbidity issues. As such, COVID-19 is an ever-changing situation. So there's a frequent change in practice, there's frequent change in decision making. The guidelines of last week may not be the guidelines of this week. So you need to feel that you have to read all the time. You have to collect guidelines all the time so that you know what exactly is happening. There's too much of information overload. It can either be through social media, it can be fake news. You don't know which to believe. As a medical professional, people will be asking us which is the right one and wrong one. You're not the expert to answer that questions. There's too much of information overload, and there's an inability to deliver the care despite taking the oath. And I think that probably highlights the whole situation, because our oath of looking after the patients and to provide care, whatever the situation, we feel helpless. We're not able to do that. And things like lack of available essential resources like beds, the face masks, the PPE, the ventilators, and this is like you can't change any of those situations, and you're not able to deliver the proper care for the patients. Now, worry about the risk to self and family. That's the other thing. So when we all come back, after seeing these patients, even when I'm not seeing COVID patients, I've got 2 elderly in-laws at home. So I have my bath immediately before coming, before doing anything else. 2 kids at home. So wash your hands, change your dress, go for a bath, and then only. So you worry about how risk to ourselves as well as to the family. And again, when you do the shifts, before, in Kerala, at least I know that the doctors who are looking after COVID patients, they have a shift of 14 days. And after 14 days, they actually have to go to quarantine also. So they're doing a complete shift of 14 days, then they go for quarantine for 14 days, and then only they come back home. So the separation from family and loved ones, and that's again, you can't see them. You can't talk. You can talk to them, but obviously you can't see them and you can't touch them. So that is going on for some time, and it's like we don't know how long it's going to last. That is the uncertainty of how long it's going to last. And obviously, if somebody has got pre-existing mental health or addiction issues, and that again will be compounded, and all this can be compounded with the risk factors, and they can be more prone to have burnout. Next slide, please. So I also went through the literature to see whether there's any evidence or in sort of research or studies has been done so far regarding this COVID. And what I found is there's been lots of editorials and write-up about the need for giving this psychological support and psychiatric support for the patients, for the healthcare workers looking after COVID patients. But so far, no further original research has been done, except two of them. There's one more that I just added last. I don't think Rajlakshmi brought that slide. So basically, the first is about the 54 patients of physicians has one symptom of burnout. This came in an editorial which is written in relation to SARS, but actually data was from the previous data before the SARS. It's a normal count of 55% of physicians reporting burnout. Now, and this study was done 3 years after the SARS outbreak. So the study was done in 2006, and they did a survey among employees who had looked after SARS patients, and they did a survey after 3 years, and they found that over the 3-year period, 10% of employees still have got the post-traumatic stress symptoms during the 3-year period. Now, and the two of the ones that I found from COVID specific was, one was about the study was done again in China. They compared the medical staff working on the usual wards for unfit patients. They actually went for oncology wards, and they compared the medical staff working on COVID-19 patients. And what they found was the medical staff working at COVID-19 had less sort of symptoms than those working in, and they went for oncology wards. Now, the reason what they found was mainly because one is those who are working in the frontline workers know more what's happening. So they have got a greater sense of control of the situation. They have got a control in the workplace, and they know what's happening. The other wards people, they don't have the the detailed knowledge about what exactly is happening. So that can add on to their stress. And then the second point that they suggested was because it's oncology wards and oncology patients, and everybody knows that oncology immunosuppressed patients, their patients, if they get COVID, can be affected more. So these workers are more worried about that. So what they're trying to say is it's not just the frontline workers who's looking after COVID-19. All the physicians, all the medical staff will need some support, because they also can have burnout in this whole pandemic situation. There was one more paper, I think, which is about the rate of insomnia among the doctors looking after COVID-19 patients. And this has got recently published in Trondius of Psychiatry. And there was about 39% of doctors looking after COVID-19 patients reported having insomnia. Next slide, please. So how do you reduce burnout? Now, I've divided this in two ways. One is this is for everybody. So these are specifically some suggestions that you can that any of us and any of the organizations should be able to sort of adapt, so that we don't suffer from burnout. And then further on, I'll tell about specifically for COVID frontline workers, what we have suggested in the ebook as the interventions that can be done. So this is divided into three. You can have it's personal, it's professional, and it's organizational. So I think we should, the self-care and personal thing is something that we all can do. So probably we should concentrate more on that, because you don't have to depend on your organization for that to happen. So you make sure you get adequate sleep, adequate nutrition, exercise. You should have some hobbies, some relaxation techniques, meditation, deep breathing, visual imagery, massage. Always try and maintain a good work-life balance. Always have self-awareness technique. Always try and get involved in non-work related activities. Find some sort of hobby that is not related to work at all. Try and develop some sort of coping skills for stress management, organization. Then time management is very, very important. The reason sometimes we feel so stressed is because we don't have enough, we don't finish things on time. And that's not, it's not because we're not trying, because our time management skills are not adequate enough. So time management is very important. Organization, communications, then a bit of spiritual care, psychotherapy, attending to one's spiritual needs, and also develop a philosophy of care for everyone. All these things comes under the personal care. Now, professionally, how can we do things differently so that we don't suffer from burnout? So you can improve your communication skills. So basically, sometimes of complaints and things are happening because your communication skills are not up to date. So all those soft skills, we try to work on them. Communication skills, increase your clinical knowledge, be up to date with your clinical knowledge, read upon the clinical guidelines, go for peer consultations, and assertiveness skills. Sometimes we need to learn how to say no to some situations. So you have to improve your assertiveness skills, because if you feel too stressed, you can't take on additional jobs. So improve your assertiveness skills, and also things like adding research and teaching and other academic activities other than clinical work. So don't be just doing clinical work all the time. Try and do some research work, some academic work and teaching that will take your mind away from the clinical work. So all these are the professional things that you can do to avoid burnout. And third one is organizational one, which the organization should be able to do for the doctors. So when you provide the adequate resources for them, give regular and adequate supportive supervision, give the schedules that can give a schedule that can accommodate the work-life balance. Again, as I mentioned before, recognition and reward. Try and recognize the doctors, reward them, supportive work in the community, regular discussions of challenging cases. So you could have different units in a same department, in a same specialty, having different units, having different MDTs, academic challenges, and we ourselves have got a small group which we call as an academic group, where we do cases every week, and I find that's really, really good, because you could share the cases, you can share the clinical knowledge, and also it's like in the end you actually have a chat also, so something like an informal session, which I find quite useful. So things like that you can try within among yourselves. As a debriefing session or as an academic discussion. Next slide, please. So I come on to the intervention that is specifically in this COVID environment, what we can suggest to the frontline workers. And our principles that we suggested in the ebook, it's mainly based on 3 things. So teamwork, establish and maintain a sense of belonging at work, and enable and build on the emotional and social connectedness of the doctors, and or focus on a blend of work and life. Next slide, please. So this is also, again, divided into 3. So how can organization change? How can the team itself change? And how can the individual change? So coming to organization, I think lots of organizations are trying their best to actually do that, because they're trying to restructure the workplace. There's different delineation of the roles, responsibilities. They divide the workload. They're trying to empower the healthcare staff. So I've seen lots of webinars, and even I think General Hospital is giving classes to nurses and other doctors working other specialties about ventilator skills if needed. So that doctors are getting trained on the things that they don't normally do. So retraining of the empowering them, retraining them, and also train them on the education and safety of the PPE, disinfection. Everybody is getting training about that. So we all know, I mean, the people who have to wear the PPE know that how to wear it properly, disinfection. Then adequate equipment should be provided to the frontline staff. Working hours should be limited, regular breaks. So suggestion that the doctors looking after COVID-19 patients, they shouldn't be exposed to more than like 8 hours. So shift should be cut down, because there's a chance of increasing viral load if you're exposed more. So your shift should be according to like that. Give regular breaks, predictable schedules, and also a structured process to deal with the care for the frontline workers in case they become infected COVID-19. So as soon as we know that there is something in the backup there, suppose we get infected, there's a structured process to deal with that. So all this is organizational responsibility for the frontline workers. Then as a team, the frontline team that's looking after the COVID patients. So how do they do that? There should be clear goals. The goals should be set up very, very clearly. There should be guiding philosophy of how to do this every day, and also always share the responsibility with the team. It's not just the treating frontline doctor or the nurse who's responsible for the patient. It's a whole team. So any decision that you take is a responsibility to the whole team, not just the doctor who's looking after them or the nurse who's looking after them. So it has to be a sharing attitude, a caring attitude. And spread the work among the staff and the family members. So what can you do for them? Give additional roles to people and feel that make them feel wanted, and take time out, gets volunteers or auxiliary staffs. And buddy systems. Buddy systems are basically where more experienced worker is paired with a less experienced one. And this can happen in doctors as well as nurses. So they can learn the less experienced person will feel more confident, and and they can learn from the more experienced person. So that's one thing that you can try. Interaction between the team members, very, very important. Interaction about non-work related interactions. You ask about the family. How is your mother? How is the children being taken care of? How are you coping with the travel? So you ask about non-work things with the team members, and that's very, very important. Feedback, again, if somebody has done something right, the nurse has done something good, just give praise to her. Feedback to her then itself. And say that you done a good job, you looked after the patient very well. So that's feedback on the job. Debriefing, if some difficult situation has happened, reflective practice, reflect on that. If it's a difficult patient to manage or a difficult decision to make, or maybe a young patient who died with COVID-19 on a ventilator, you're not able to save the person, even if the person, that is also happening, isn't it? So you debrief about that, you talk about that. And let the workers vent about the emotions. Continue to have online counseling, offer online counseling with the mental health professionals, ventilation, validation, discussing how to cope, give them time to learn, and always when there's new staff coming, welcoming attitude to staff. So these are things that the team actually can do to help them cope with the situation better. And then, as I said, the individual or the personal one, always get help. If you can't, if you're feeling too stressed, if you're feeling burned out, just don't suffer alone. Get help. Make sure you get the adequate time out. And all your goals should be realistic and gratifying goals. Don't try to achieve things that is not possible. So set forth realistic and gratifying goals. Self-monitoring and pacing activities. Try and find some relaxation, mindfulness, and always have the sense of hope. And always continue to have your contact with your family and friends, either virtually, by phone, by laptop, by Zoom, anything that maintains a normalcy. Try and maintain to have that contact with your family and friends. Next slide, please. Just one more slide about self-care, because it's very, very important. Because if the organization fails or if the professional fails also, we can do this. So self-care is very, very important. All those things that I've talked to you earlier, it's a proactive and a holistic approach to promote the personal health. That's the meaning of self-care, to support the professional care of others. It's basically not just for us, because if we have to work as a good doctor or as an effective doctor, we need to be healthy enough mentally and physically to do that job. So self-care is not just for us, it's actually for us to provide the support for the others, and always maintain a range of personalized self-care strategies, and that will be different for everyone. Some people it'll be music, some people it'll be movies, some people will be going for a walk, some people it'll be the pet, playing with the pets, reading books. So there are lots of things, and these strategies are different for different person. You have to find your own strategies, and that can be with both professional and non-professional context, and then manage the barriers and enablers to self-care practice. So there can be lots of barriers, but try and manage them. You need to find the time for yourself. That's a priority, because you need to look after yourself, and you have to make sure that all the barriers are managed and move forward. Next slide, please. So suppose, if all this happens and the doctor, all the healthcare professional does have a burnout and does become stressed. Now they have to be referred for mental health assessment. And these are some of the features or some of the signs that you can look forward to your colleague or even for yourself. So basically thinking that are they expressing suicidal ideas? Are they going to depression? Any sort of violent or aggressive behavior? Is there an uncontrolled? So I mentioned addiction is a possibility. So there's an uncontrolled use of alcohol or drugs. They're crying all the time, expressing uncontrollable distress, or sort of unexplained or bizarre behavior like talking or smiling to self, and significant deterioration in the occupational function. So you can see that the doctor is not functioning properly. They need help. So make sure that the person is referred to a mental health assessment. Next slide, please. Now, a few words about the other specific issues that can happen in a pandemic. So I mentioned that the medical personnel can go in quarantine. Now, this can happen due to various reasons. Medical personnel can go into quarantine mainly because in their job they had to look after patients who happened to be COVID positive. Later on, you're hearing lots in the news now. Recently, there's some other WhatsApp forward saying that somebody died in a cardiac ward. Nobody knew that the patient was COVID positive. So and later on, it was tested to be positive, and then everybody had had to go in quarantine. So we hear the news all the time. So what happens to these people then? They'll be concerned about the understaffing issues. They themselves will have a guilt and fear that they have actually transferred, they must have traveled everywhere, so they have transferred the disease to a lot of people. And obviously they'll feel social isolated. So this can happen to, specifically to medical personnel who goes in quarantine. So how do you support them? Again, the immediate colleagues know what's happening. So keep supporting them, keep phoning them, updating them that everything is fine here. Don't worry. You have to be in quarantine. That's fine. We are looking after ourselves, and also give support them also. Regular social contact. No, don't let them suffer alone in silence for 14 days. Keep in touch with them and keep the support over the phone. Now, life and death decisions, I've described this before, the difficult choices that you have to make, the allocation of sparse resources, how to explain the difficult decision to the affected families. That is the most important thing. How do you do that? How do you explain that? So always discuss all these decisions in a group. And make sure that this is a group decision. It's not our decision. It's not an easy decision, and it's not something that anybody, there are lots of people who's doing this job all the time. Even for them, it's not an easy decision. So the frontline workers who are not used to doing this decision every day, is going to be very, very difficult. So discuss in a group, discuss their emotions, and if in case, discuss in a group. And if you don't have anybody to talk to, like in the professional setup, there's nobody to talk to, then try and discuss emotions with a close friend. Obviously, thinking of the patient confidential, things like that, but talk about emotions. Don't let it build up in you. Okay. So talk to somebody, at least your professionals. If it's not, then to a family friend or a close friend. And third one is stigma. Again, this also is coming everywhere in the news now. We can see that we are being stigmatized by the general public just because we are doctors. You could have a hurtful social distancing, maybe if you go to church or into religious places, or if there's even news in the news about landlords denying a residential accommodation just because they are doctors. Maids refuse to come to work because we are doctors. So we're going to face this throughout the coming months. So that is again going to affect us. So how do you do that? So we as an organization, and we have to make sure we support each other. The organization has to ensure the safety of the staff and encourage the staff to remain connected to each other. And also things like honoring the frontline personnel. So, our Prime Minister asked everybody to clap for us, which I think is very, very good. It's and lots of countries are doing that. It's not a scientific explanation I'm going. It's a basic, it's a basic act of clapping for us. And all the organizations are saying that these are the doctors, these are the nurses, they are the frontline warriors, they are fighting for us. Everybody is saying that. Yesterday, one of the nurses working in GH, she was coming. She had to go out, and she was coming back, and the two-wheeler had a badge saying that she's a nurse working in GH. And immediately, I think she was stopped by the police officers, and she was given a drink of watermelon juice to drink, because they were showing lots of respect for the nurse, because there are a lot of people doing that also. So similarly, the healthcare organizations can support their staff, the frontline staff, the doctors and nurses, and all the workers, all the hospital staff who's actually working them, and try to honor them and give them a lot of psychological support. Next slide, please. So to conclude, take-home messages from the session is healthcare workers are prone to burnout. Everybody will face the situation. We all will face the situation at one point in our life, and be aware of that. It's not abnormal, it's normal. You are going to face that. So be aware of that. And pandemic itself has got additional risk factors of burnout. So the important thing is to have an early recognition and prevention needed to avoid a mental health pandemic. And as we said, I think Dr. Shita mentioned that next thing that's going to come is probably a mental health pandemic. And that is not just in the public, it might come in the doctors also. So be aware of that. And personal, professional, and organizational steps can be taken to reduce the burnout. Next slide, please. So I'd like to conclude by a quote from Dalai Lama: in dealing with those who are undergoing great suffering, if you feel burnout setting in, if you feel demoralized and exhausted, it is best, for the sake of everyone, to withdraw and restore yourself. The point is to have a long-term perspective. Next slide, please. Next slide. Okay, thank you very much for listening. And there's some contact details in case you want some references for the talk, and obviously you can contact Rajlakshmi at Pallium India for the slides. All the references for the papers that I've described are in the notes of the presentation. And over to you now, and we'll take questions now. Thank you very much.
Thank you, Sunita. So the session is open for discussion. I think there will be many comments. Anybody has comments or questions?
Dr. Chitra, would you like to add something? I think Dr. Seema is also there.
I was just thinking, I think we have a lot of other mental health professionals other than doctors. So this is meant for everyone. It's not only for doctors. So this can affect any person who is involved in caring for others. So this also applies to family members. So any carer. So when you are empowering somebody else, it is to make them be aware that this kind of this is possible, and we can actually take care of much of it if we are being aware of it and use our resources well in terms of the minimum support that we have within ourselves and outside us, your friends, your family. So I think I would wait for questions to discuss further.
Is it okay if I make a comment?
Yeah,
Yes,
I think,
Moira.
Yes,
Moira, and then
Yeah.
I think Vinita has asked another question. So Moira,
Great. Let's take Vanita's question first.
okay, so Vinita has asked whether doctors are at a risk of resorting more to pharmacological interventions than non-pharmacological to deal with symptoms of anxiety, depression at this hour. Very relevant question, Vinita. I think, I'm sure Moira will also have things to say, but I think so. It's not only for anxiety, depression. I think sleep is the main thing, and sleep and stress. Like there is a common way of saying stress, like tension. So people will say, "Oh, you're tense, you're anxious." Even if you go to a physician, the first thing they write is a medication rather than exploring to what is actually happening with you, or how can you deal with it just by understanding about it and using it, coping with it well. So yes, there is a tendency for medical professionals to resort to pharmacological interventions. I think it is not only for anxiety, depression. I think I mentioned yesterday that people in this kind of a burnout, and Sunita also mentioned, can come up with psychosomatic symptoms. That is aches, pains, headache, tiredness, and then you can take medications for that as well. So this is a risk, especially when we are working in palliative care too. So this applies to everyone, and especially in a crisis situation where you feel that you are actually having an illness, and then immediately you resort to pharmacological methods. Moira?
Sure, I was just adding something to that. I just a couple of comments. Sunita, thank you very much. Very helpful and very grounded in reality. My suggestion I was going to make was that we take what you've been saying and actually think of that for ourselves, and actually take some time during this presentation or afterwards to think, what are those key issues for ourselves? Because you highlighted many possibles. But also, I think there's something that we do in palliative care, which is hold uncertainty, acknowledge helplessness, not have solutions. And this is something we have become used to and trained to manage. It still has its challenges for sure. And we find meaning in that. And I think what is striking me too about burnout is when you don't sense any meaning. And therefore, the burnout may be worse for non-frontline workers who are feeling quite helpless, as if they have nothing to do, or for people on the periphery of situations, or people who can't do what they normally would do. So I wonder if people just want to comment on how we take this issue that we deal with in palliative care day by day and help our colleagues to deal with it. Helplessness, uncertainty, that feeling of not having all the answers. I wonder if anybody could comment on that issue.
Can I say
Including,
something?
of course.
Can I say something? Or shall I wait for somebody else?
Oh, ma'am, say.
Yeah, you can.
No, I was just saying, Moira, I agree totally with you that probably we at least we think that we are well equipped or more equipped relatively than other professionals or other healthcare workers, because we are constantly or we are consistently exposed to uncertainty and more of mortality, and we deal more with family members, talk to them about dying, talk to them about goals of care. So we are constantly, so what we are trying to empower other healthcare professionals is something we are actually doing in our regular routine clinical practice,
Yeah.
isn't it? So that is
I
very
kind of
good.
wanted to ask the group if they had any comments on that from their own circumstance, especially the non-palliative care.
Yeah, I
colleagues.
wanted to say that probably the difference in the pandemic or the crisis is that there is the time constraint and also the rush of things. Did you lose it?
No, ma'am, we can hear you.
Okay, let me wait for other people's comments also.
Yeah, I was more asking people just to share from their point of view how they handle these issues and what help they would value on how to do that.
Anybody from non-palliative background can actually comment.
Anybody?
Anybody at all who just wants to comment on that issue?
Just one observation here. Communication, clear, transparent, useful communication, as we have been really talking about, would be very useful in dealing with burnout, especially among the team members.
Okay, thank you, madam. Anybody else?
Does anybody else want to share any of their own experiences or any team members' experiences?
I think there are no comments, madam. You can continue.
So Lipika says that from her experience, non-palliative care doctors and nurses are at more risk for burnout, especially when there's no scope of conducting any awareness programs during this crisis. Thanks, Lipika. I think that's exactly one point that we were trying to say, that being aware that this experience is, to be expected, to be prepared for it, is very important, and to be empowered to manage with it. It is quite important that, and the risk for people who do not, who are not aware of it, going through this, suffering is much more. So I don't know who Galaxy A30 is, who says that accept the situation, talk about your problems to your close friends. Anybody else who wanted to comment about that? And I can hear prescription for ourselves. So is that the prescription? Who's Galaxy A30?
It's Shobha, ma'am.
I think she was replying to my earlier comment above, where I was suggesting that we write a prescription. So,
Shobha,
some suggestions are coming.
Can you speak about your prescription? Shobha?
Yeah. So I was, coming through my phone. So, so Moira's comment about prescription for ourselves. I think the first and foremost thing is to accept that we are under a lot of stress in any given scenario. It could be due to several reasons. Like Sunita said, from the work atmosphere, when there are few people to work, when there are a lot of patients, from your own family background, whatever is happening around you, so that can stress out the team. So if we have a good team and if we can talk about it and say that, okay, I'm seriously, I won't be able to talk to this particular patient today, or counsel them today. So will you be able to take up that for me today? And it shouldn't be a regular thing, but you can always ask for help, and also create a platform for your team members to talk about themselves and give them the opportunity to be free and say that I'm going through this problem. So what do I do? And we should be kind of, especially the junior staff, we should be aware what they are going through and encourage them and facilitate them to come out and discuss about their problems. It's not very difficult to do that once we have a kind of a base understanding, work ethics with them. That's what I would say.
Okay, thank you.
Anyone else who can bring up a prescription individually?
Deepika said I've shared 2 documents from IMA in our WhatsApp group.
Sure, okay. Vinita Riju says, encouraging to write narratives for getting over some difficult scenarios. They're very good suggestions.
Dr. Satendra has some questions.
Yeah, please ask.
Yeah, this is from the perspective of a non-palliative care physician. And our new competency-based curriculum in India, it talks about a very important goal of an Indian medical graduate, which is that of a lifelong learner. So, and this current COVID pandemic has taught us to face the fear of managing uncertainties and to recognize the complexity of the structural constraint that patients and doctors operate under. And that is why it is very important for us to constantly, develop the habit of self-critique, reflections. There was a talk about reflective writing, and narrative is another way how we can contribute to that, to develop our empathy. So I think it is very important to prevent the burnout is that you need to develop your interest in the various fields of medical humanities. And we constantly, judge your own biases, constantly self-reflect. And I think that is a good framework to go ahead to keep your interest as well as understand the biases and respect the uncertainties which the whole medical profession is all about.
I think it's a very, very significant point that you pointed out, Dr. Satendra Singh, because it is also good or significant that our curriculum has started including such concepts in training. And palliative care is one of the specialties who's taking the responsibility of teaching these modules in medical colleges for students. So we hope that in the future generations, at least the awareness and the preparedness for facing such challenges would be much more than what we see now, and we could face these challenges in a better way. But still, during the process of a crisis, it is very challenging for healthcare professionals to go through that, experience. And I have a very important, it's because also it's a very personal kind of thing. For me, what has worked very, it's similar to what Shobha said. She said about sharing and talking to friends. I think mentorship is very important. So if you identify 1 or 2 mentors in your life, I mean, they could be from your professional field or from someone who is mentoring you, like some senior professionals, colleagues that you have, and you also establish a relationship with them, not only to discuss academic and clinical matters, but also your personal, not very intimate or private things, but you can actually ventilate and validate your issues and share with them. And what helps is that what helps in this is that you get an objective perspective about something which is very subjective. When you react to some situation, it becomes very emotional. It's because it comes out from a point of or a place of stress, distress. You are distressed, so what you react or your response will be very emotional. But when you have conversations with a mentor, they help you place this in a very objective perspective. So you start looking at it in a very different perspective and start exploring it in a different manner. And that makes you develop strategies that are also very objective and not responding in very, like in irritability or anger or sadness, but looking at objective strategies. I hope I'm making sense.
Yeah, I would like to share my experience. So when I was doing my post-graduation in pain and palliative medicine, I thought that joining pain and palliative medicine will not be much stressful, because all the patients are end of life care or patients who don't need much care. But after joining, within 1 week, I think we had a psychiatrist, visiting psychiatrist, and he had a class with us. And the first question I asked him was, how can I reduce my stress? That was the first question. And another experience was, and the answer he gave me was, he didn't tell me anything. He told me that you will learn it over this 2 years how to cope with the situation. And that was his answer. And another situation was when a patient was in severe pain, and we couldn't do anything for him. We tried many medications, opioids, interventional analgesia, all those things. But uh, the pain was severe, and we couldn't do anything. And I was totally stressed on seeing that patient is suffering, and even I thought of leaving palliative care. So that was a Sunday, and in addition to this, there was another child who was in ICU, who died in the ICU. And the oncology physician who was on duty, he was my friend. He told me that he will not be able to tell this to his mother, and he asked me to come and tell this to his mother. So you know that, however, whatever be the method of communicating bad news to a mother, her baby is died, it will not be a good scene. So she fell down, and these things happened on my duty day. And I thought, um, uh, from there onwards, I made my strategies to take care of myself. So when the patient was in pain, I was completely sitting with the patient, and that was still in my mind. And after that incident, I whenever the patient have distress, I will be there, but I will not sit there continuously with the patient. I will take 5 minutes break and will come to the nursing station and will again go and see the patient. So that was one of my strategies to take care of myself. And another thing is communication with the caregivers and the patient. If you communicate properly with the patient and the caregivers, then you will have peace of mind. So these are two. And another thing, as Chitra Madam told, finding out somebody to share the problems. So I usually share it with my wife. So these are few strategies I developed over a few years. So thank you.
Thank you, Sunil, for that. Raji ma'am had asked a clarification about the talk. So she had asked a question about what is emotion work variable. So basically, what that line in the features factors contributing to burnout. So that's basically what is about if you are looking after a patient for a long time, like you've got a chronic relationship with the patient, which can happen to our patients also sometimes, and then the patient suddenly dies, you could become emotionally attached to the patient. You could actually grieve for the patient, and that can affect your work. So that is what I mentioned, what I meant when I said emotional work variables. So that even without that, even death in our own family, sometimes, you know, when you come back after a bereavement in our family, I've had personal experience of, you know, my grandfather died, so I had to come all the way from UK to India. I was very attached to him, and you know, a rough time here. When I went back and I had an A&E job, and I saw a patient, and he actually looked like sadly like my grandfather, and I was in tears when I was seeing the patient. But at that time I was not doing palliative care, I was doing my FY2 or something. So nobody cares about what, you know, it's a busy job, so you can understand. So then I felt really bad, and then I remember when I was doing a palliative care hospice job, I had a junior medical student who had a bereavement, and I made sure that she didn't see such patients, or, you know, she didn't have to go and see patients who are dying, because it's very, very important. Sometimes those feelings come back to you, and when you're affected, so, and you can become stressed. So take a time off. There's one thing that I forgot to mention suggestion is taking personal time off. The organization should make sure you get personal time off, grieving time if this happens in the family. You don't have to, you're not expected to come back to work. Again, my grandmother actually died in Amrita, and when I came back to work, it was very, very difficult for me because she died. I had to come back to the same place where she died. So all those emotions come back. So you need to make sure your colleagues and friends and juniors are actually, if they're going through that, make sure they get time off and things like that. Okay.
Thank you, Sunita. Any more comments?
I think Sunita's comment is wonderful about giving ourselves some space, yours as well, Sunil, and actually giving each other permission to have sometimes when it's harder, sometimes when something triggers for us. So, if we're working in these busy teams, please look out for those and encourage them to take, or even replace them for a bit, to take those spaces and to give permission to ourselves and to other people for that. Thank you, Sunita. There's great suggestions coming on our lists here.
Mm. So shall I just read out the suggestions then? So art and creativity, one of the most important ways of expression. Music too, Chitra ma'am's suggestion. Shobha ma'am has said, we have morning meeting every day for an hour where we discuss about patients and also talk about the team members, how we can facilitate excellent patient care. Dr. Mary, hobby should be revived. I spend a couple of hours twice daily on my balcony photographing birds. That's really good. We see a lot of them nowadays. Yes, Shobha ma'am, everyone is on the same page about patients and there's no ambiguity regarding management or communication related with patient. That's very, very important. If there is a difference of opinion between doctors, we have to talk about it, and the team leader should ensure that everybody is happy with the decision. That again happens so much of in the ethical discussions. Again, I think I've also had personal experience again, same thing, because sometimes I feel the patient is not dying, others feel the patient is dying. I'm not comfortable to make that decision. So everybody in the team should be happy about that. So that's very, very important. Pravina, Dr. Pravina, even spiritual care like religious service and praying enhances our self-positivity. We need to first identify our stress and manage accordingly. And we share that in common source for photos. That's Moira to Dr. Mary. Okay. And at times we need to ignore all the negativities that surround us and hamper us from leading a blissful life. Okay, Dr. Lipika has said we take
There was some further up as well.
Yeah.
I think Dr. Satyendra said something about poetry, and that is my thing about art and creativity was in response to that.
Yeah.
So it's very important.
And beauty.
Yeah, and beauty, yes.
So Biju has suggested, from philosophical point of view, not taking ourselves or work too seriously. Regular reminders is needed. Yeah, that's true. Things can happen even if you don't go to work. I was at home for 28 days. Nothing happened at general hospital. Things go on even if we don't go. So it's not, we can't take ourselves too seriously. And moment of silence, Chitra ma'am, for myself is important for me. Dr. Geeta, tea meetings should be encouraged in all the departments where all the staff are equally engaged in participating. And Dr. Satyendra has said, we have launched a new poetry section, Pandemic Virtuosity, in our open access medical humanities journal.
Seema has said, reaching out to others and finding meaning.
Yeah.
But I was just looking, somebody asked about how we can recognize, we have to first recognize our own stresses. I'm trying to find who said that again. Is it Pravina, was it? Pravina, do you want to say something about that? Maybe not, but that's a very important point, that we have to also recognize where we're getting stressed. And I think Sunita went over that and others can comment, but I think that's right. Recognize where we're getting stressed and also recognize how we can protect ourselves. And these are fantastic suggestions coming here.
Are we saving these chats?
The recording is getting saved, so the chats will be saved.
So I think.
Is Dr. Satyendra able to share us the link for that humanities?
Yeah, I have shared that on the WhatsApp group. I'll share the link of the journal here
On
as
the
well,
chat,
in
yeah.
the chat box. Yeah, I will do
Thanks.
that.
Okay.
Vishnu, please save the chats.
Sir, which chat, sir? Yes. Okay, sir. It's okay.
Yeah. So it's Dr. Pravina who said we need to first identify our stress and manage accordingly. It's true, isn't it? It's not everybody won't be having the same stress. Everybody won't be having the same stressful scenario. So we need to make sure what actually stresses us more and manage that accordingly.
So actually stresses may be from the professional point of view or from the personal point of view. So we have to take a paper and write it in the paper in the order what has to be finished today in that order. And then we have to finish it so that we will have some peace of mind. So the least important thing will be at last, so that you will be more comfortable. And another thing which I think Sunita told was taking break holidays is very important, which usually practically I am not sure how much it is applicable, but I think that is very important. Physician which who work in Kerala or India, I think it is not possible, or I'm not sure. Even though you told that 28 days nothing happened in GH.
It's because others were covering for me, probably. It depends on, again, it depends on the organization, how much people are there to cover for you. If it's a single person, then you can't do that, isn't it? So it's actually has to come from the organization and not just ourselves.
And Sunil, I vividly remember the cases that you were referring to. In fact, Dr. Rajagopalan is the one who said that you really wanted to leave after that pain management was not successful, that particular case. And then you gave him continuous deep sedation, isn't it?
Yes.
Okay.
Yeah. Please continue, Sunita. I'm sorry.
Dr. Hasina has mentioned, can we make a group? So Dr. Satindra has shared the link. So if anybody wants to look at that, and it'll be in the chat anyway, can we make a group on Facebook and post some poetry or writings like, and or the Sistina related to COVID or anything coming out from our minds? It's allow us to vent our feelings for those who love to write. That's under suggestion, and obviously because we all know this is the last session, so if you've got any other suggestions, any other feedbacks, please fill the feedback form. But I think ECHOs is a generic feedback form, which is just, it's a generic question. So if there's specific suggestions that you would like to tell us, please do that now, and we'll actually take it to Palli. Yeah, go on.
Ma'am, this is Praveena. Sorry for the break. So like I was telling that only because I'm a dentist, I'm from a non-palliative field. So through like contacts only, I attended CCPPM at TIPS. So like I felt like we need to identify the stress, because I have worked under so many senior dental professionals. So I've seen like for them, if they don't get patients, like minimum of 5 patients per day, my sir or ma'am will get stressed up. So, so that is the case. I'm in Chennai now. So if they don't get patients, they are really stressed up and worried about their profession and their per month income. So like stress vary for different people.
Yeah. So some people, too much of patience is a stress. Some people, too little patience is stress. I agree.
Yeah. Okay, so thank you all. I think today we need to get feedback. Rajalakshmi, I think we are doing it today in a different way.
Yes, sir.
Can you describe what we are going to do now?
Sir, we have a live poll only. It's already shared. I think it's visible, sir.
Yeah, it's visible.
Yes.
Okay, you have to poll it. It's a request. It's a poll it now. And this
so all of you, please do it and submit it.
Yes, we are waiting for your valuable feedback because it is very extremely important to us. Please do it now. It's a request.
This is a good way to make sure we do it, eh? Well done.
That's true.
Did it come with echo or this is PalliCovid India's idea?
Now this looks different. I've never seen this
Guided
before.
by ECHO only.
Oh,
Not by
okay.
PalliCovid India.
Yeah, it says echo, isn't it? Diminish my professional aggravation.
Only 3% voted. We are waiting. Now it is 7.
You won't close the session without everybody voting.
I think the faculty might not be doing it. That is why.
Yeah.
Yeah, you need to also please design one for faculty, Sunil.
Yeah.
I've submitted mine.
Everybody can.
Thank
do
you,
this.
ma'am.
Great.
How many are
Raghavan
waiting
has
now?
suggested I'm part of a WhatsApp group, Laughter Best Medicine, of like-minded people and dedicated to sharing things that would help us lighten our life. We all have similar sense of humor and hence it works for us. That's good.
Bijou, I can't really imagine people with exactly the same sense of humor as you. So you're going to have to share some of those things with us.
That's a real special sense of humor. So I wouldn't want to elaborate on that.
Just give us some examples sometime.
Yeah. That I thought that was a page from old Reader's Digest, isn't it?
Oh yeah, Laughter Best Medicine is from old. Yeah, that's true.
Yeah. We are just bunch of totally different kind of individuals, but we connect on the laughter part. And it's not necessary to be a group. We just have a laugh out of anything. Just don't take ourselves too seriously. That's my
Bijou, you
take.
promise for me sometime, Dr. Bijou, promise for me that with your PPI on, you do one of your famous dances and put it up and video it. I think that's going to be
All right.
encourage us all.
The day I have to put a full PP, then I will do it and I'll send it to you. Yeah.
How many
Wonderful.
How many saw Biju dancing in Guwahati?
I've seen Bijou dancing for more than a decade, and it is worth it, I promise you.
Yeah. Yeah, that's one thing. That it's good exercise. It's great for the endorphin. Yeah.
Yeah. Very true.
Okay.
Okay, one more point. Moira mentioned an important point. There was some evidence from Italy that health workers who were too exhausted and being too heroic actually became more susceptible to COVID. Okay, that is actually quite a valid and important point, Moira, that probably everybody...
Yeah, it was passed to me secondhand, so I didn't see the original paper, but it was passed to me from UK colleagues who were just re-emphasizing that if we're not, just like you said, rested and well nourished, we are then going to make ourselves more susceptible and then further the problem. So we need to make sure we have, one of the UK hospitals is asking people to work 3 days, 12-hour shifts, then 3 days off, for example.
Everybody completed?
No, sir. Now 62% completed, sir. That is 50 out of 24.
Faculty.
No,
then if you come to faculty, that's fine.
Okay. I think we can wind up this session now. So thank you, Sunita, for this wonderful session and for a law at last for our self-care. Okay. And thank you all for your active participation, the PalliCovid group and all the participants who have actively contributed to this session. And thank you all. Thank you.
Thank you.
Bye.
Thank
Bye.
you.
Bye.
Thank you.
Bye.
Thanks, everyone.
Bye.
Those who are not voted, please vote it and go. It's a request. Okay, thank you. It's completed. Thank you.